Reports indicate that as the first quarter of 2022, over 300 nurses traveled abroad for career opportunities and better conditions of service. The Ghana Registered Nurses and Midwives Association thus wants government to revise the service conditions of its members to curb the overwhelming rate of nurse migration in the country. Speaking at the first senior managers meeting for the year 2023 in the Ashanti regional capital, Kumasi, Dr. Mrs. Rita Brechum disclosed that the Ghana Health Service is doing their best to make sure that better conditions of services are provided. She added that non-financial incentives have also been put in place to make workers more comfortable, especially in deprived communities. She further highlighted achievements and challenges faced by the health service, advocating the collective effort of all stakeholders to improve on the universal health coverage.
And therefore, we need more incentives to make these staff stay. And we are asking that whenever we post staff to areas that are less endowed, the community members, the traditional leaders, and all those who are in that area make life easier and more interesting and bearable for our staff so that they stay and offer health care. Yes, it is true that some of our staff are leaving for better working conditions outside, but we are also doing our best to ensure that those that are left do not feel so disadvantaged. We have put in place some non-financial incentives to make people more comfortable to work in areas that are not so well endowed. And it is the financial component we want to add to it that is not yet ready, but we are working towards that. And that is why we are asking community members to also help us make our staff comfortable when we post them to these areas.
On his part, the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, assured the public of FDA's intensive surveillance program to halt the sale of fake and substandard medicines in the country. He added that the Ghana Health Service will collaborate with the FDA and the media to achieve a universal quality health care for all.
They are making it look like the original, and so that's why FDA has a routine mechanism to do market assessment to see, identify them and remove them. So the fact that FDA is able to find them means that that system is working. Facilities will not know which medicine is fake or not, especially if they are done very well, but some of these assessments are done. Sometimes it's the health service that report that we have been using this medicine, we are not getting the desired results, can you check for us? FDA also does that randomly and identify them. So that's what it is, a system that is in place to ensure that as the fake medicines come in, we are able to identify them quickly and eliminate